Good evening, everyone, and welcome to tonight's webinar. We are going to get started in just a minute. We've got folks that are coming in, and we want to make sure everybody has a chance to get in to hear this important topic. At this point in time, I would like to turn it over to our panelists to introduce themselves. And again, tonight's topic, just to make sure that you are in the right place, is understanding meltdowns. It's a panel discussion about behavior. So I think, was it Rachel? Were you going first? Okay, take it away.
Hi, my name is Rachel Kolb. I'm a clinical professional for the Wilmington office of the Autism Society. I'm a BCBA and a psychologist, and I really love working with this agency, and I'm excited to participate in this panel tonight. Thank you for having me.
I think I'm next. Hey guys, I'm Leah Cruzen, and I'm also in the Wilmington area. I'm a BCBA and licensed psychologist as well, and also very excited to be here. So looking forward to hearing what Mary and Nancy and all of our colleagues have for us. Should be a good talk tonight.
Great, thank you, Leah. My name is Kim Tizard, and I am the Director of Family Support for the Autism Society of North Carolina. And I will be on the panel later this evening. So thank you so much. I'll turn it over to Nancy.
Hi, my name is Nancy Popkin. I'm one of the Autism Resource Specialists with the Autism Society of North Carolina, and I'm based in our Charlotte office. Autism Resource Specialists are all parents of children with autism, so I am a parent as well as a professional with the Autism Society of North Carolina. Tonight, before I hand it over to our first speaker, I just want to let you all know that after we have the privilege to hear Mary Janka speak, we will open it up to questions, and there is a Q&A feature at the bottom of your Zoom screen where you can submit questions, and we as a panel will be working together to help bring you information and answer your questions. And so with that, Mary, it's all yours.
Okay. Hi, I'm Mary. I'm an adult on the spectrum, and I'm also an advocate for the Autism Society. I am a working teacher. I have a master's in special ed emotional behavioral disorders, and I also am certified in multiple general ed subjects. I currently teach regular ed math, but I work as a coach for young adults with autism, and I also taught kids with autism. And I'm excited to talk to y'all about an area that I have struggled with. I have written articles, blogs for the Autism Society, and one that got attention was on meltdowns. And interestingly, I had a few recently due to current stressors. And so I took data, it was really helpful, and I'm excited to share that with all of you. Maybe something may help you. And I'm really, really grateful that I can take what I've experienced and give back. All right, so again, I'm just going to talk about just how it is personally. I'm also going to time myself so I don't go over, because I tend to talk a lot. So I just get really excited. So just a little bit of my background. I was diagnosed at 33, and I always had meltdowns off and on, and they were considered to be my fault. I struggled socially. I often got in trouble. People thought when I would have a meltdown, I was just doing it because I want to be a brat, or I was being a crybaby. And it just made it worse because I wasn't in control, complete loss of control. And all I heard was all the bad stuff. I was very lonely until I found theater, and I was unmotivated to do much in school until I got a job. My struggles continue to this day, and I gain a lot from helping others. So this opportunity to talk to y'all is huge to me, and I really appreciate that. Anything I can do in the future, I would love to do. So just to kind of give you a sense of how it feels to have a meltdown, it's horrible. It is horrible. Your child or you or a friend of yours who has autism, we could be like being the most horrible person in the world, but and I know it's hard to take this because it's hard for you and I get it and I'm so sorry, but we're really, really hurting because it's embarrassing. Just no control of what's going on here. And we really need control because there's so much in this world we don't understand. And so when you have that control taken away, it's the worst. It's scary. Um, it's just terrifying. Things that go on in your head. This is what I've experienced. This is what my students, I see them done when they have meltdowns. Um, just things they say, things I say, things I think. It's just, you're the worst person in the world. If you're talking to a child or an adult having a meltdown, they're just going to say things like, what I've seen, this is what I've seen, not me, but things they say like, you're the devil. And they'll say all these curse words to you and things about themselves that are horrible. And I mean, sometimes those really are the feelings we have deep down. And I'm going to get into that in a minute of why we go there. Okay. But in one's head, it's like a tornado. Okay. So a trigger of something small opens up all these other things and they're going on as a tornado. These are ways I found how to get out of it. This is taking years of figuring it out. The first thing is getting to a safe place. And a safe place is just whatever feels safe to the person. In a school, it could be like a room. It could be going to an adult that you feel comfortable with and drawing. Or for the child, it could be going to their room. As a child, my mother would send me to my room. For me, it's having to get home. Okay. Talk therapy, not necessarily for the adult to do with the child, but at first until I learn, I have to like talk myself through it as I have a meltdown. I have to keep telling myself it's going to be okay. Everything's going to be fine while my head is being bad and telling me that I'm horrible. I'm just checking the time on my phone. Excuse me. Distractions help. This is a therapy a lot of practitioners do, teachers do with people in distress, is they will try to say things to break their mindset, break their channel of thinking, to think about other things. I can do this myself by looking around, thinking about something positive, thinking about something different. Mantras are like repeated mantras of saying something over and over again. It'll be okay, you're fine, you're fine. Just trying to block your thoughts. Don't let yourself think it. And then box breathing. Box breathing is something they use like in the army, they use in psychotherapy, where you breathe in, count 4 seconds, hold it 4 seconds, breathe out 4 seconds, and then no, like things like that. Things related to that with controlling your physical state gets you out of your headspace. What happens after? And this is what I studied in grad school with kids with emotional behavior disorders. The behavior specialists here can speak for it. Y'all have seen it. It's like a deflation of a tire. It's like we're overpressured and then it's just fatigue. We could seem zoned out. Just what, huh? We might need high calorie foods because it burns a lot of calories. The brain uses a lot of sugar. So I found that sometimes I need fast food. I'm going to get fast food after this. Sometimes the kid needs just something high calorie. Depression often happens because one can feel very ashamed. Self-loathing is very common because it's horrible. It's something you can't control, but people just don't accept it. And then a high need for affirmation, and praise and something to hear from someone else is such a high need. Now in a meltdown, if someone's in starting a meltdown or just beginning it, believe it or not, it can increase. Often, and this is from what I've seen working with kids, from me, from reading about it, is continual exposure to the stress. Like if a child's in a classroom or among a family event or somewhere loud, and it continues whatever's triggering it, it will get more and more and more. So they need to be removed. If a child's having a meltdown or adult and they can see other people looking at them like they're crazy, I mean, other people can't help it, but it adds to it because that's more information going in here, adding to this growing tornado of bad thoughts. I'm bad, I'm bad, I'm bad, I'm bad, which creates the cycling. So also, when I was in grad school, working with kids, talking about kids who were escalated, we were trained to do talk therapy. We were trained to talk to kids and have them talk out. No. More talking often puts too much in here and can increase it. And also, when in meltdown, this brain is not talking normal. It just needs calm. It needs to slow down. All the jumbling thoughts just need to stay. So just let the child be. This is my opinion. Different for everybody. So all this stuff, it's pretty much what's going on with your child or your adult self-esteem. Like the self-esteem is very, very low. Many adults struggle with depression because this is me, just my own opinion. I feel like we are very poor because we don't have what a lot of people who don't have autism or related disorders have. We don't have satisfaction from good relationships. We don't have life satisfaction. We often don't know it, but we see others have it. We don't understand and we feel poor. You don't realize it. We seem cool. We're just copying your behaviors, but we are severely deficient. We don't have friends. We don't have meaningful life. And so many adults on the spectrum struggle with work. And we just want to feel, we just have that need. And because of our social challenges with the disability, it's hard to get it. So the struggle, okay? We need relationships. We need to feel wanted. We need to want to be able to give back. I've been in mental health support groups because I've had depression from it. And they really push the need to volunteer. Kids, they get a lot from volunteering. Adults, we need to have our thoughts and feelings validated. So if you have a friend with autism, you don't know why you do it, your child, if they're constantly asking you the same thing over and over and over again, there's reasons. Anxiety, it's not understanding what's going on. We need that validation. I'm sorry, it's annoying. It just takes a little patience. We are very social creatures. All humans are. We may not seem that way. Autistics may come home and just want to block everything out, play video games. It's from frustration, not understanding, needing a safe space, place of control. Okay, for life satisfaction, we need to feel useful. We need a goal to complete for the day. Seeing that our work benefits other people is huge for anyone. So when I have this poverty in either relationships or in work or both, it creates anxiety. Think about the anxiety that anyone has when they don't have money or they don't have food. They have anxiety. We have anxiety because we don't have the relationships. We don't have the life purpose. Those are also essential life needs people don't think about. Without either, we feel poor or wretched. A fear of losing either causes anxiety. That's why we're anxious all the time. People say autistics have anxiety. It's because we don't have these things. We don't understand. We're around people who don't have autism and they think we're cool. We're not. We're just copying y'all. So pretty much that. So that's why praise to us is so huge. That's why we're so dependent on your praise and your affirmation. That's why we need it more than others. I apologize, it's work on y'all, but in exchange, you get a child, you get a friend, you get a worker who's more loyal than anyone you can have. Not really, is my opinion. But it's so big to us. I don't know if you know it, but when you gain the trust of someone on the spectrum, they totally trust you because you've met these needs. We need love. We cannot read it. So please overdo it. Please tell us. Please show us. If we are visual learners, show in pictures. Give praise whenever possible. Show a happy face if you can. I know it's hard right now with stressors with COVID. Give visuals of acceptance like stickers, happy faces, stars. We don't need presents. I've saw this with my students where they kept getting presents. Nobody needs presents. You get it, it's done. It's just one of many things that shows that you appreciate. So you can do it way cheaper, way better, way more frequently with a word or a thing. Give us tasks we can do. It makes us feel good. My students would feel so good if they were given a task in class. Show us that you need our help. How we can grow is if we get praise for our desired behaviors or for being on tasks, being on task. If you give us attention, if we see that we're getting that love we need, that acceptance, that usefulness, we will keep doing what you want us to do. We don't want to change who we are. Who we are and our autism are different. Our autism is just something about how our brains work. We want relationships. We want life meaning. So you're showing that we're doing that will make us do the desired behaviors more. We will change our actions to meet that praise. And that is ABA, that is behavior therapy, that is what teachers do, that's what psychologists do. And I'm telling you, as someone with it, it helps. It makes us feel safe. So watch those meltdowns decrease as our basic needs are met. The past few weeks, my needs were not being met. So small problems were creating meltdowns. People will see someone with autism have a small problem, have a meltdown. They're like, that person's being a brat, or they're sensitive, or they're anxious. It's not, I promise. It's the bigger things. Okay? When the anxiety rises, the meltdowns rise. The anxiety is from these two big problems. Okay? This is what I just said. I'll leave it up here a minute. I'm not going to repeat it because I just said it. Now, meltdowns look different in everyone. Your child could do a thing. I do different things. I start off with what I do, which is crying fits, which is like, oh, big deal crying. I have friends, coworkers, peers that say, I have meltdowns too, and it's crying. Autistic meltdown's different. Again, this is my opinion, but it's a complete loss of control. Non-autistics, I'm sorry, and I don't mean offense to anybody, but they'll say, for me, it's a huge release. It's not for an autistic. It's horrible. It's scary. We don't want it to happen. So we could see crying fits, you could see tantrums, you could see cursing, you could see yelling, you could see aggression, kids breaking things, spacing out. They could put their head down. So it could be outward, it could be inward. There's all sorts of forms. So why do we do meltdowns? Why do we have these meltdowns? If we want people around us, if we want friends, if we want relationships, we want life purpose, why do we have the meltdowns? That's what people could think, like, why? I mean, they're horrible to be around. No one wants to be around someone yelling and screaming and breaking things. I mean, why would a friend or employee do this? Why would I want to hire, if I were a boss, why would I want to hire an autistic person who's going to have a meltdown? And why would your child be mean to you? You're a great mother or father, you do so much. Why would they yell at you? Why would they call you curse words? Believe me, we don't mean to, we don't want to. We feel so bad about it. You mean everything to us. We hate ourselves as we have them. It's a complete loss of control. It's almost like our anxiety is so bad that we make them happen. We fear the worst, so the worst happens. So that's why we need so many feel-good tasks and accomplishments. Saying it again, praise and accomplishments are everything to us. Having a goal and completing the goal are distracting and they're healing. These fears start to go away, the meltdowns start to go away. Now we can talk about what triggers are, in case you're keeping track. So triggers are small problems. They can be anything from annoyances to the self, from puberty, like physical changes, like, oh, what's my body doing? I'm 13, I'm a guy, what's going on? Why am I sweating? Those are physical things. Those are things that one cannot control. We get anxiety about things that we cannot control. We know if we stink from puberty, but we want friends, this is building up in here, causing anxiety because we're not getting our needs met for friends. Physical discomforts, change in routine. It's a small problem, can trigger things. Hunger, increase in stimulation, too much going on in here. If I'm like at a theme park and there's all these noises, I could start getting, behaviors from other people, interpretations of other people. I could be looking at anybody, and if I'm feeling inward anxiety from not having a need met, I misread you, I can have a meltdown. Happened to me last week. It did. It wasn't pretty. Also, meltdowns, I don't have it here, meltdowns can happen from something really happy that you're anxious about. Okay, I'm gonna talk on interpretations of other people. We have trouble reading other people. That's autism. Not for everybody, we're all different. Sometimes people can seem unhappy with us, and that can make us go off because we want people to like us. Sometimes we can't deal with that reality. It's not fair to you. It's not fair to us. We have these meltdowns, that we act these ways, we have these undesired behaviors, but our self-esteem is so low. We need interpreters sometimes. We need you to explain to us what other people are doing and thinking because we can't read it. It's just something about our brains. I have had to always ask, even at work now, I've had to ask people, what do people mean? Because I don't understand. I can't read everything people do or say. I can't read faces. Sometimes we have stronger intuition than other people and can pick up behaviors that non-autistics can not. So your child might be telling you like, Mom, Dad, I don't like that guy. I don't trust the guy. And they're great. But your child could be picking up something that you're not. And that's kind of one of those mysteries I don't quite get, but I will pick up things others will not. Might be because my senses are really strong. I can smell of someone who's lying if they're afraid because they're lying. And I might say, I don't like that person. You might be, that's fine. We do have these gifts. Sometimes meltdowns can occur where you don't expect it to, like in a safe space. Child's at school, they come home, they go crazy and you're like, what's going on? I love my child, it's calm here. Why are they going crazy here? They're great at school. If stressor, it depends where the stressors are. Like if it's at the classroom, if they're having stress all day at school and then they come home, they'll keep it together at school because they know that's expected to act cool. Then they come home, they let it all out because they feel safe. They take it out on you, they feel safe with you. I'm sorry. If stressors are going on at home, if there's a divorce going on, like the fighting going on at home, I mean, it's okay, it happens. Then the child will have a meltdown at school. I've seen that too. Sometimes the meltdown will occur at the actual place. So the child will just remove themselves or need to get removed and just withdraw for a while. Now, in this whole past year, there might be a higher risk of meltdowns, actually, especially now, because we are coming out of quarantine, we're going back out again. There's a lot of change. A lot of change in environment. We're going from a quiet, safe space to suddenly being around people, all that noise, all that smells, all those things we taste and all those senses that will be taken in will overwhelm us, overstimulate our brain. So just be prepared as we start going back out again, you might see more meltdowns. Also, during this whole time of COVID, before things are getting better, you might have seen more meltdowns from us because we saw you stressed, and it's not your fault. It's okay. It's how it is. But if any of you felt stress from financial challenges because of no work right now, we can sense it. We're very, very, very sensitive. And when we see you stressed, we get stressed, and then we show it. So if your child is verbal, wants to get better, I'm just gonna take a couple of minutes, if that's okay. How to help manage, help as your child is able, educate, like how they're, like what they have, get them on board with getting better at managing their feelings, help them with therapy sessions to work out like their needs, like their needs for friends, their needs for work them toward those goals, help them make schedules so they can start to feel control over what changes are happening, especially now as we go from quarantine to going back out again. You can make schedules, what we're doing today. They'll feel calmer about what's happening. They'll feel some control. You can write out schedules or you can do it in pictures, like 7 a.m., draw a picture of a toothbrush for getting ready. 8 a.m., breakfast, draw a picture of food. If they're nonverbal, okay. If the more able they are, the more they can speak up for themselves, you can just change it to their needs. Collect data, keep a notebook, small book in your bag, purse, or car. Write down what you observed from a meltdown. It's a little book. What happened before? Is there a pattern? What was used to shorten the meltdown? This is what behavior people do. Behavior specialists is called FBA, functional behavior analysis. They look at the function, they ABC, they take the antecedent, what happened before, the behavior, and then what could change it, all this stuff. I'm not getting the letters right, I apologize. But you can start yourselves. Other means of management, anxiety is just gonna be there. It's just how it is. We live anxiety. So while we work on meeting these life needs, because friends, getting a job, these are huge long-term goals. So as for now, how can we handle it? Anything to help calm. Like I use weighted blankets, I'm not gonna lie. I use bead bracelets. I have one right here. This is one of my heavier ones I play with. I was starting off the meeting doing this, but I realized it was noisy, so I took it off. I took a nap before this. I read, I talk to people, I exercise. Other people use video games, they hang with pets, they have quiet times, they have things to chew, fidget toys, etc. And so if we were able, it'd be interesting to know what you or your child or you use. And this is my last slide. These are just some resources. There are a ton. I did this first thing I thought of. I'm speaking for the Autism Society. Hey, they're my people. Their website's got a lot of things. It's free and it leads to other stuff. A lot of great people that are specialists there that will lead you to other things. Teach is great. That's actually where I got diagnosed. I like the Mighty. It's a website because they actually will have people on the spectrum that are pretty reflective and talk about what it's like. There was actually an article on what it's like to have a meltdown just last week. I like Facebook support groups for autism and ADHD. Just pick and choose what works for you. And I like any biographies by autistic adults. And I believe that's the end of my presentation.
Thank you, Mary. And folks have put some questions into the Q&A. I don't know if we want to wait to do that till the end or if we want Nancy to pick up at this point in time. What would your preference be, Mary?
I'm flexible. I'll let you guys decide because I'm flexible.
Okay. I'm going to see if we can get Nancy to come on camera now. Nancy, do you have a preference?
Hang on. Here we go. I think why don't we go ahead and jump into the Q&A. We have some great questions lined up already. And then as we get close to 8:15, I guess, I think that's right. Am I all right with the time?
That's fine. It'll work.
15 minutes before we're supposed to wrap up. If you want to cue us, and we'll pull up some slides. I know that our clinical team that's on board has a couple parting thoughts to share with folks. And we do have a couple resources. Mary already pointed that out. So, we want to go ahead and share what ASNC has, and we'll do that at the end.
Okay, well, then I'll go ahead and read questions out. Or Mary, I don't know if you see them on the Q&A part. Would you prefer me read them or do you want to read them?
Can you read them?
Yep. First one it says, Mary, this is so helpful. It's great to hear from you what meltdowns are like and what they feel like, what's going on with them. The question is about the distractions during meltdowns. Can another person suggest a distraction, or is that something that you need to do yourself?
Either way works. This is actually, the whole meltdown thing is a huge learning curve for everybody. It depends too, I would say, on how able the person is. I recently have been able to manage my own distractions. I'm 44. I've been teaching a long time. But working with young kids with autism, they're learning early how to manage. So you can teach and they can learn how to distract themselves. But I recommend if someone else can help, that would be great.
Wonderful. All right. The next question that we have is, what do you do when your child is having a meltdown and they hide and they say they hate you? What are some things that you would suggest that a parent or a caregiver do that might help in those situations?
A couple things. One choice is to let them be if you know they're going to be safe until they calm down. And then when they're calm, check, ask if you can talk to them a couple of times because they didn't want to get in that. Believe me, they didn't want to be there. They didn't want, they love you. They didn't want to be there. And then when they're ready, talk it out with them. If they don't seem safe, find any way to get in there and make sure they're safe because they could be doing, you don't want them doing self-harm or anything like that. You don't want them destroying property. That's what I would suggest.
Well, and I think one of the things you said earlier was don't take it personally. It's the moment, and it's the stress and the meltdown that's being vocalized. So excellent. The next question that we have is a mom would like to know if you have ever had fits of anger, lack of control, or lack of control over your patients, etc. If you've had those types of attacks or moments, who has helped you calm down, or what methods are available that are more whenever it's a rage attack or it's an anger motivated meltdown?
Oh yeah, that's a really good question. That's taken a while, and that can take a while for a lot of people. I have always tried to, this because I'm motivated, like I'm really, probably everybody is, and then people just get, when we get depressed, we give up. So I've been through periods where I just give up. But when I'm motivated, I seek out people who can help me. And I often educate them what I need from them, or they seem aware. But I've also read books on how to handle anger. I've really worked on mindfulness. Like, I'm sorry to get away. I'm like, oh, whoa, wait, I'm sorry to get really angry. Okay, cool, chill. And when I worked with students, I teach them how to start to be aware of their own anger and how they can manage that. And there's like tools you can find, like little visual pictures they can use to figure out when they're getting angry and how they can get in a happy place, and just different strategies. And these behavior people can help you.
Yeah, yes. Well, and that's the thing. I know that we're going to hear from Nancy in a little bit, but certainly anybody else weigh in if you have thoughts on this. We've got 2 more questions.
Okay.
And first
David,
one is,
David,
Yeah, go
before
ahead.
you get to the next question, I just want to,
Certainly.
think it might be a good time in case the rest of the panel might want to chime in on some of the things that Mary has said. I know we have a couple visual examples of things Mary just talked about that we can share with the people who are watching us, which means we're going to be sharing screen and unsharing screen off and on. But I think I looked like Rachel and Leah were like, wait, we have something just like that we could show you. So maybe let's do that before we get on to the next question, if that's okay.
Definitely.
Okay. I don't know if anybody wanted to jump in. I know I'll just start by saying, Mary, I know you were talking about using some calming procedures to help for the person who is struggling. And so we have to teach them how to do that. And I know our BCBAs had provided us with some examples of some visuals to help cue a person to use a visual strategy. So maybe Rachel and Leah, if you want to talk about that a little bit, I can pull up those slides and show everybody what that might look like. Would that be okay?
Yeah, that's perfect. I was also I just gotta say, it's so interesting. Like I love hearing your perspective on everything we talked about so far. To add to the bit about the parent who had the question about the fit of anger, or the seem to be fits of anger, I think kind of if you can get to the root of the trigger, trying to figure out what that is, that will definitely help you in the long term. But from what I'm understanding from Mary and from what what we know about meltdowns, is it might be a culmination of things that are happening, and you expending that energy in other ways as well, exercise and movement and that sort of thing, is great to have on a schedule and help the person, as when they're in that moment. Just a reminder of what Mary mentioned earlier about not talking too much, that sound and extra stimulation may contribute to a meltdown that is happening. So if you are managing a moment like that, just doing your best to support your loved one, while also trying to maintain a calm environment to ensure their safety, your safety, and a greater sense of calm. If the environment doesn't feel calm, then they're less likely to calm down more quickly. So just hanging by that, and if your loved one's able to communicate that they want you nearby, or that they don't, asking them like, do you want me close? Do you want to be alone? And establishing that, if it seems like their body language wants you out of the room, and they can be trusted to not engage in property destruction or something like that. If the anger is directed towards you, then by all means, that is communication. They may need that space, and that might be the only way that they know how to establish space in that moment. So just considering that, and maybe looking forward to figuring out better ways to help them communicate that in the future would be my recommendation, if that's the case.
I also want to second that. It's been so helpful listening to Mary, and thank you so much for sharing your experience with us today. I was just going to speak a little bit to the visuals that Nancy is going to be pulling up, kind of circling back to what we've all been talking about. When someone's in the moment and a lot of talk is too much to process, and a lot of things going on where maybe someone's trying to share with you what you need to do to calm down, sometimes something like a visual support can be really helpful. So we use these a lot of times where we may teach them preventatively. So we teach them outside of the moment where you're feeling frustrated or you're having a full meltdown. And it can be something that they're practicing therapy or with you all as a family, and learn these strategies that may help your child individually or you calm and find some peace. And then these visuals can be provided in that calm space at times to be a reference that you can keep the environment calm and quiet if that's what the individual needs. But then these can be a reminder of strategies that can be used to help someone kind of regulate and come out of that moment. So Nancy has a few examples of some of those visuals that we have that help with both activities that might be helpful, using some pictures or some written prompts, depending on where the individual is at with reading or identifying pictures. And then we have some that are just about kind of helping you identify what your emotions are in those moments and what you can do. So just wanted to mention that. We have examples with timers and with different sensory items that may help the individual to structure that time and to know kind of what to do in that moment. Yeah, you can go ahead and add anything to that you want to, Nancy, but just wanted to kind of give a framework for how we use some of these visuals as a preventative teaching tool, and then to be available so we can have a calm and non-stimulating environment when you need less talking.
Yeah, and I think less talking is really a key. And it's very confusing when someone is talking at you to not respond. And I know with my own son and his meltdowns, when he would be really in that moment of just peak emotion, he was able to read. And so I would get out a dry erase and write, I see that you're upset. And he would immediately just stop for a moment and read it. And it almost brought it down a tiny bit. And he would say, you can't talk now. And I would just write, okay. And so just so he wasn't getting too much from me, it allowed him to sort of regroup. And I tried to be slow about asking questions, not bombarding him with questions. Do you want this? Do you want this? Do you want this? And that helped him too. And sometimes you do need to give that space of just, I see that you're upset. Go get your bunny. Go draw some pictures. When you feel better, we can process it. And that's in the moment. Mary, go ahead.
I wanted to add to both what you and Leah said. Leah, something you mentioned about, being sure to say something to your loved one, like to let them know you're there. That's something I forgot to say, and it's huge, because when I've had them and like I'm around other grownups and they just kind of like look at me like I'm crazy or ditch me, I'm like, don't do that. I need to feel safe. I need to feel like you're still there. So even if you just say a quick, I'm still here, that's huge. Just to let them know you're still around, no matter if they want you around or not at the moment.
Mm.
I had a quick comment. This was fantastic. You did such a great job, Mary. Just I could sit and listen to you talk all day. We had, and I remember Nancy and I used to work, serving families for many years side by side. And I had a teacher tell me that the visuals that we made for the child, she looked at me, and whispered and said, "I'm a talker. And when I have to use the visuals with her, it was for a young lady, she said, it actually reminds me to stop talking." And so I can see for those of us parents that kind of lean towards wanting to talk, and if the professionals that are listening too, that those visuals help us too to remember in that moment, stop the talking. So thank you.
David, why don't we bring up the next question?
Yeah. Do you mind if I give a quick thought, Nancy, before? So we're talking a lot about not talking, right? Like creating some silence and creating a non-stimulating environment. But we also mentioned earlier that if an individual doesn't know how, whoever it is, if it's you or someone else that you're supporting doesn't know how to distract themselves quite yet, how do you teach that then if we're decreasing stimulation? So I think what you can do is, if you know that something is calming to that person or calming, whoever is helping in the situation, bring those routines if you can, if you can transport those things, or give a like gentle, guide, or say, "Can I get you out of here?" Or "I'm going to get you out of here," or whatever it is to guide them out. But so example of that is if your little one has a blankie that they love, super calming, but that your loved one becomes upset, they're like, "Oh man, oh," and you see it building, bring the blankie in. It looks like you need your blankie. Go. And then just sit. So then the quiet comes. But wanted to point that out.
Excellent. I'm going to go a little out of order from the way that the questions have come in, because there's one that was shared here from someone who mentions that they were not diagnosed until the person was in their late 50s. But he shares, "My meltdowns tend to be from sensory overload. I don't act out, but tend to escape immediately to a quiet place. I have to do mindfulness exercises, and I focus on things immediately around me until I feel safe." So there's another strategy that folks can employ, and it's always good to have a quiet place to go. So thank you for sharing that. One question, two questions that are kind of short. I'll go through those because they're shorter. Mary, are you able to be angry without having a meltdown? The question is, are there times whenever anger is appropriate? Meaning you could, I guess, you could be angry without going to a meltdown because somebody might have done something that made you angry. I think that's the point. How do you handle that, or how is that different from a meltdown?
That's difficult because I used to, when I get angry, I would kind of pull in. And I learned that oftentimes anger, we don't know how to express it right. We pull in it, it turns into depression. And then later on meltdown. I'm actually 44 years old. Just recently went through a transformation where I went from pre-Catwoman into Catwoman, just because a couple things that happened that made me like angry, and it felt good, like to actually be angry and act on it, in a mature way. But I think it's just takes like a long time ago, I had to take an anger management class, and I had no idea how to anger because it can be internalized, like I said. But then when I know what it was, when I learned to kind of separate myself from myself, or I kind of want to be like, you can't treat that person like that. And I'd actually want to do something about it. Where because my self-esteem is low, I had to kind of separate and be like, I had to see myself as my own child, be like, you can't treat my child like that. And then my anger became healthy because I would do something about it. And that's just mine. Everyone's different.
Yeah. No, thank you for sharing that. And then, if this one, if the meltdown is a nonverbal meltdown, are your suggestions the same for managing or handling that meltdown? Are the strategies that you would recommend the same?
Yeah.
nonverbal. Okay.
Yep. Exactly, pretty much. Yep. It's all scaffolded. Like depends again on whatever they can handle. You know your child, you know who you're working with. Again, visuals for smaller, the suggestions on whatever keeps them calm place, and then things that will get them out of it. Distractors can be, if they're nonverbal, like a video they like to see over and over again. Baby Einstein video, you know, it's all, you know, it's just whatever.
Other panelists like to add on that from your experience?
I was just going to add that I know we talked a little bit about the visual supports and how those can be helpful if you can teach someone strategies using visuals. And those can be for people who have vocal communication or are not vocal communicators. So you can use pictures and teach someone through other means than verbal teaching. So modeling and using reinforcement like Mary talked about earlier. I also think these times are really powerful to have a parent or a caregiver kind of co-regulate with that individual and sit nearby, maybe model that regulation skill for them. And I don't know, Mary, if that's something you found helpful, but I know that's something we often recommend is for a parent, you know, maybe we can't talk to you and say, hey, you should take some deep breaths right now, and you know, squeeze your stuffed animal, but I can sit nearby you and I can squeeze a pillow and show you that, and I can take some calm deep breaths, which is probably good for me because I might be a little agitated right then too. So showing them that, you know, you can use those strategies by modeling, I think can be helpful in those moments.
And it gets us out of our head too, because we'll see someone go, oh.
To add to what Rachel was mentioning, think about, you know, so, you know, if you're supporting the support strategies are the same, right? So decrease stimulation, create calm environment. But then if you're thinking about building some potential advocacy skills, you might think about it differently of what are the critical things that my loved one needs to be able to do. They need to be able to get themselves out of that uncomfortable situation. So, you know, indicating that they're leaving or grabbing a caregiver's hand if they need supervision to leave, and working on those things in that moment. You know, of course in that moment, but then after the fact of this is how you say no in a situation, and this is how you can access that. I'll keep these tools that you love and that help you feel calm in this specific space, so you always know where they are, and build the environment in a way that lends itself to communication through not only pictures, but also the objects around and the environment itself.
And I just wanted to add to, you know, when I talk to parents about the meltdowns, I feel like we're looking for what is the thing we're going to do during the meltdown so that it doesn't happen again. And that there's nothing. So instead, you know, we manage them, which is what we're talking about tonight. But always remember too, after it's over, take that moment. Mary did something really important when she was presenting. She showed you the little notebook where she sort of takes notes about antecedents, what led up to it, and what was the behavior that she saw, and what happened, what was the consequence of that. There's that notebook again. And I think as parents, we can do that too. We should do that too, because you can start seeing patterns, and then you can maybe, you know, do something on the front end that will prevent a meltdown and make them fewer and less intense. You know, we're teaching them skills, so they're maybe less intense. And we're also creating an environment where there may be fewer needs for meltdowns. And so we want to make sure we're paying attention to those things as well. So I just wanted to make sure we do that.
I'm going to bounce right on top of what Nancy just said and give you personal experience with my son. Exactly what everybody's been saying. And I remember when I was trying to teach him to breathe, and you know, he was virtually nonverbal for the parent that asked that. And I would be trying to show him how to take breaths, and he was so mad that he would was hyperventilating. It was like, just, you know, and I thought, oh no, what am I doing? This isn't going to work. And I wanted to throw in the towel. And I can tell you probably within 6-7 months of me calming down and doing exactly like Rachel said, just taking the deep breaths. And now at 25, he does it on his own. He doesn't even need to be reminded. He can read his body language. So this is not a quick fix. This does take, you know, some time. And so, you know, I can't remember who it was, if you, Mary, said, or that this
Box
isn't
breathing.
a sprint,
Mhm.
you know, that it's a marathon or what have you. But it does take some time.
Awesome. So I want to jump back to another one where it talks about a little bit different aspect of this. If you have a child that's doing something that is not okay, and they need a consequence like a timeout or a break from doing that thing, what's a good way to curb the behavior or to stop the behavior without causing a meltdown? For example, when child's other brother doesn't want to play and the younger one screams for hours, literally because they're all alone, what do you do?
Can I respond? There are a lot of like one behavior strategy is to give them what they want for behaviors that you want them to do. And then when they're doing these behaviors you don't want them to do, don't give them the attention, don't give them what they want. Because sometimes when you, I mean, yeah, we think all the time like that child just needs this, they'll stop. Sometimes I call it Helen Keller syndrome. Sometimes like before she learned how to communicate, she threw things, she kind of just acted out all the time. That could be that. But as the child learns to communicate, they're going to continue acting out. But they want the positive reinforcement. So ignore those if you can and give what they want for the behaviors you want. If they're doing something that's really bad, you just got to deal with the meltdown, like just pick them up or do whatever and get them away. Like just sometimes you just got to deal with it and deal with the yelling and screaming. And if they tend to do that in public, don't take them into public until they can manage. It will get there.
Thank you, Mary. Other thoughts, comments?
I think when we're thinking about siblings, that was sort of the example. Sometimes we need to teach them both, the child with autism and the neurotypical sibling, you know, how to communicate with each other and play together. So we almost have to stage it and practice. I know that when my children would play together, my son might get frustrated with her when he was younger, and he would want to squeeze her, and that was not okay. And so we put together a box of things he could squeeze and put it in their play area. And then we taught his sister that if he is feeling like he needs to squeeze her, to go get the box, give him the box and move away. and he would use it, and it gave her some power and safety. And he wanted to squeeze because he wanted to make sure she understood that he was mad at her. And so, you know, sometimes we have to teach them how to play and give them some extra tools to do that.
All right. One other question that we had that came in is, this question might not be about meltdowns. I'm just going to read it verbatim, but our 4-year-old has started picking at his butt lately when the situation gets difficult. So the challenge is that the 4-year-old picks at his butt when the situation gets difficult. Could that be a stress management skill, or is it possibly a sensory issue, or both?
You want me to answer what I do? I don't do
Well,
that.
I was going to defer to the panelists because you all are the experts. So whoever wants to go first. Mary, would you like to be up first?
I mean, I noticed that I like pick at my scalp when I'm like stressed or in my head. And I read that people on my Facebook groups, because like I said, I'm not educated, long expertise, like all these people that will have awesome things to say. Just saying as an individual, I saw it out on Facebook, again, people with autism, ADHD, anxiety, the whole picking and stimulation. It's either like we do whatever. I've seen kids like chronic nose pickers, just because we're so zoned out or just anxious or preoccupied that we do it. But again, I'll just be like doing this and I'm like, stop it. So unfortunately, the butt picking is like definitely less acceptable than the other things. So that would be a good one to find a replacement behavior for and kind of decrease that one. Because I know other things people do, they'll chew things until they grow out of that. Like I said, mine now is this, so I can kind of get away with this.
Yeah, I think finding a replacement that would fulfill the same picking, might be helpful, and having it handy so that, he can use it in those moments. And if it is sensory, reaching out to one of your autism resource specialists to find out if there are occupational therapists who address sensory needs, that can be done separately and through therapy as well, if it's just a sensory thing that they do, not just under stress, but all the time. So that might be, I think you probably hit the nail on the head with the sensory part.
I didn't show y'all online here, but I also have this really cool labradorite stone I was staring at before, because look at the cool, so I use them. I use my sensories.
I was just going to add that I've had a couple of kids that I've worked with who've had sensory needs that involve peeling or picking, and sometimes it can lead to picking at fingers or picking at skin or chewing on fingers, things like that. And sometimes finding something like we've tried like pillows that have the sequins on them that slide one direction and slide the other direction and change colors. And sometimes you can pick at those with your fingers and change the color of it, or even like laminating a piece of paper and putting a bunch of stickers on it and letting them peel the stickers off. Something that gives them that sensation of picking and peeling in a safer way has been helpful with some of my folks who've engaged in those kind of behaviors if you're looking for a replacement.
Excellent. Going to check that one off. We had one that came in, and I think that my translation is pretty close here. Parent is saying that if we knew what it was, if we knew what would help them calm down, we'd do it. I guess that's why we're having this session tonight. So we're all in this together. In the case of my son, it's very difficult because what I may use that calms him down today will not work tomorrow. And then it's a challenge because I have to guess what I can use to calm him. So I think that the question is centering around how can you come up with something that will consistently work to help calm a child whenever they're having meltdowns. And my guess is that Mary might pull out the visual prompt again, the little notebook, because part of what you've talked about before is documenting some of these things. So other ideas for the parent about, the challenge of one thing works on one day, doesn't work the next day. Panelists?
One thing that I think is worth, I know this talk is about meltdown specifically this evening, but I think that it is important to mention that there is a differentiation between meltdowns and tantrums. Tantrums being that there's a need that exists but hasn't been otherwise communicated, right? They're using a tantrum to in hopes, well, not necessarily, they're becoming upset because their needs haven't been met through other means. So I think I'm not sure if your child has a form of communication that caters to their strengths, but trying to evaluate what the situation is by taking that data really, and if it sounds like if the thing that is the most calming each day is sort of different, it may be that they're trying to communicate that they need that specific thing. They just don't have the words, the sign language, the gestures, or whatever it may be to communicate that to you. And that being said, not having your communication needs met, that's really frustrating. I can't begin to relate. I'm neurotypical, but I imagine that enough of those things compounding, you may be looking at meltdowns too, you know, so that's not to say that it's one or the other, but just I would look into figuring out a communication system.
I just wanted to add to that. I definitely agree with everything Leah just said. And I was also just thinking, like, if the situation, and I don't know this individual specifically, of course, but if it's that some calming strategies work better some days than others, and maybe they need different strategies to regulate if they are in a true meltdown in that moment, you know, because sometimes you do, like Mary mentioned earlier, maybe going for a run or, you know, jumping on the trampoline is what you need to bring you down in that moment. And sometimes it might be in a quiet space and with nobody around, or with music or whatever your calming preference is. Sometimes having some visual supports that provide choices of different things that you can use to calm down can be helpful in that moment, or to come out of a meltdown or regulate during that meltdown. So sometimes you want to show things in those visuals maybe that offer different sensory experiences, like, would you like to listen to music and have a picture of their headphones, or would you like to you know, go for a walk, or, you know, drink of cold water, whatever it is that is calming for that individual. So it may be that it is more of a communication based challenge, and you know, of course, that is something we always want to be looking at as a need to, we want to help meet. But if it is truly different calming strategies that he's looking for, that you might want to look at offering things visually that he could choose from.
That actually provides a nice segue into another question that we have that relates to communication systems or ability to communicate. The question, or it reads, my son is nonverbal and we do not have an interactive communication, I'm assuming, system. How is it that I can help him learn to calm down if he does not understand what I am talking about? How can I help him learn to understand me? And I think this comes back to just communication. And I'll let you all provide some strategies and tips, and maybe we have some visuals in the slide deck.
I'll jump in real quick because I have the slide deck. But to say that I'll pull up some visuals. We don't have anything that I would necessarily use with somebody at a low cognitive level, in addition to being nonverbal. So I'll give that caveat. But I think that I know as I pull up the visuals to share, I did work with a family once where, you know, we just had a picture that was one side that represented I was doing well, and the other side of the picture, when you flipped it over, was I wasn't, and trying to teach that skill of identifying that. And I think our behavior therapists can probably talk about that a little bit more, but you know, teaching them, giving them practice on that reflection of how to tell someone I'm doing okay, I'm not doing okay, just knowing the difference. I'm okay, I'm not okay. These are a little more complex that I'm showing you now. You know, saying that I need something or I want something. And actually, these are a little more simple. This is just like a simple help cue. Actually, the one on the right that has the word help on it, that actually is my son's first visual cue of support that we developed for him. He was 3 years old. He couldn't read yet. I just put the word help on it. I don't know, for me. And, but we taught him that when he was frustrated, when he felt angry, when he just felt out of control, he just needed to get that and give it to me. And I would be there. And so we were trying to teach him how to communicate, that it involved getting another person. Instead of just waiting for us to magically show up, that there was a social component to that. And so that was something that we used to sort of build that communication. And it was a process. It took us a long time to learn how to use it. But that may be something to start with. And I'll let our behavior therapist maybe jump in with where you go with that as well. I don't know which of you want to.
Sure. I'm sure Leah has things
Sorry.
to add to this as well. That's okay. I'm just going to jump in for a minute and then feel free to piggyback on what I say. I was just going to mention that some of the visual supports that we use, while a lot of these that we're showing today do have words on them, a lot of times we do use visual supports that we teach through practice, like we talked about earlier, outside the moment in which someone is feeling upset or needing to communicate a need during a time where maybe a meltdown's coming on or they're having a meltdown. But we can teach some simple things like touching a card that says, I need to be alone or I want to be together. That's something that I know Leah has used and that I've used before with folks as far as teaching, what do I need in that moment? So our visual supports can be a way for us to communicate to them through practice, like we would any communication, to communicate what we're offering in that time and that we're hearing them and what they need and to offer choices in a way that's easier to understand for someone who maybe is not in a space where they can process verbal information at that time. Leah, go ahead. I know you had something to add to that.
Yeah. So I think this is a great question because I see that we've been having a lot of conversation about things that are higher cognitive sort of skills, and I don't want to leave out this very important part of our community. So I think bringing it back down to sort of the basics, right, of how do you de-escalate somebody if you're not sure what's wrong, and the biggest answers you're going to find are going to be in their body language. They're going to be in their eye gaze. What are they looking at? Are they looking to something, or are they looking away from something? Are they posturing? So my best advice is to try to, my dog's barking at something. My best advice is to mirror your loved one's body language, posture downward, be patient in your presentation. I'm here to help. You don't even have to say I'm here to help, but I'm here to help. I'm waiting, you're waiting and ready and available. If they walk away, let them walk away. If they come to you, let them come to you and provide comfort that you think they might be seeking. But just bringing it back to that is an interactive, interaction, and that is communication. So it might not be advanced. It might not involve a break card. But if they're walking away from something, they're asking for a break. So just, those are maybe eventually going to be your teachable moments. That's how you begin to identify what maybe is missing in the piece of the puzzle. But I think that's the best advice that I can give. That, and just to remember that if your body, if you're not calm also, then, as Mary was mentioning earlier, those stressors are going to become apparent and they're going to inundate the environment. So making sure that you're also giving off those waves of calm. And yeah.
I was also going to say too, with the visual, this idea of presenting something visually, it can be an object. You can have
that's the other thing
of objects, and that's really important because that may be the level of understanding. And I've seen, families that will either use a photograph of the object or the actual object to, do you want this or do you want this? Do you want a snack or do you want your stuffed animal? And offering those and then waiting. Always make sure you pause and give them that opportunity to process that. Mary?
2 of the 3 meltdowns I had in the past 2 weeks, 2 of them I actually did what Leah was mentioning, where I walked away, and one person understood who knew me, another person didn't understand, and they interpret it. And this is from the adult, different scheme, different world. They didn't understand, and they thought I was just doing it on purpose, and that was very interesting. So all this I believe all this applies wherever you are, like parent to kids. I mean, I'm assuming a majority of people here are parents, but this applies as well to adults.
Yeah.
Really great input. I was going to mention about the objects, but even using real pictures, I know some of the examples we're showing today, are like caricature drawings or words. Using real pictures can also help quite a bit. And I'd also like to recommend that for some of our, nonverbal or younger, kiddos that we're working with, or our loved one, that it could be something else. When we talk about some of the deep pressure, and seeing if it is like some, will jumping help, in that moment. My son loved having his hands, just
Yeah.
kind of deep pressure on his hands, and that was very soothing and
Hard
calming
hug.
for him, to help get him, to regulate down. Mary, did you have something?
Yeah, like a hard hug. I actually, while I was like, oh, I'm an adult, I don't need visuals. I actually have on my phone this thing called Lightbox. And I saw this in actually an autism training video, and I downloaded it. And like, oh, it's amazing. Oh no, like it's just, and you can control it. It's like, okay. And they've got different ones you can do. And then on the back of my phone, I have something called a calming strip. And you can get in different colors. I got it on Facebook. You can just listen to it. So we use them.
Awesome. Awesome. There are a few other questions that have come in a variety of different ways. And I think that you kind of just touched on this, but I'm going to go ahead and ask it anyway. And I'll put it in like a top 3 tips. So let's share top 3 tips. The question is, what responses are not helpful whenever dealing with meltdowns? So maybe your top 2, top 3 from each of the panelists.
Who's going first?
Let's let you go first, Mary.
Okay. Number 1 is input from others, especially if it's negative, and well, it just happens. I mean, humans are humans, but it's not helpful if someone is like looking at you like you're crazy or angry, because you're crazy and angry, and it adds to it and it feels worse. Continuing to talk and tell them things that are not right, or trying to just giving more input makes it crazier. Staying in the environment that's causing the meltdown. I would say those 3.
Awesome. Who wants to go next?
I'll just say that in my experience, those are exactly the ones.
One that I see professionally sometimes is trying to teach during the moment of a meltdown. So I wouldn't recommend that. It's not your time to teach a calming skill. It's just a time to help.
Yeah, I think Mary kind of hit the nail on the head with those. It's hard to add too much more to that. I think I had jotted down increasing. So getting louder, getting closer, feeling like you have to do more when someone's in a meltdown, because I think we all want to help and we want to figure it out in that moment. And we want to ask them why they're feeling that way and what can I do? And it feels counterintuitive to step away and be calm and be quiet and take your own deep breaths and figure out your own calm in those moments. But that often is what really does help. And so kind of going against your instinct is sometimes what you have to do. And then really drawing attention to the negative in those moments. So why this is disruptive, what you're doing. Or, I mean, Mary brought up a whole lot of wonderful points in her presentation that I'm going to be reflecting on for a while, just as far as shame that might be coming at this moment for them along with these behaviors. And so, really drawing attention to being disappointed or being upset in that individual in that moment when they can't control what they're doing is really can be harmful. So I think those are the biggest things. But yeah, just seconding Mary. Thank you for bringing those things up.
Hey, Kim, were you going to say something?
Well, I agree wholeheartedly with everything that was said. And I can tell you, as a parent, early on, I'd get embarrassed by the meltdowns, and then you start to realize the teachable moment, just like, Rachel just said. And then now it's like, you all can stare, you can do whatever. I'm helping, my loved one be the best person that he can be for himself, and to be an active member in the community. So I've tried to let that, and that was just a little bit of a, confession, but early on was that. And I think through that embarrassment, I did all those wrong things that you all just said not to do. So more of a confession, and glad that I figured it out early on, but would like to just, mention that.
And I just wanted to jump on that because of what Rachel had said, and then what you said too, that we just need to, it's easy for us to think that this is about us. We want the meltdown to stop, especially if it's happening in a public place. And we need to remember it's not about us. And it's about their experience. And as Mary shared, this is a horrible experience. They feel out of control. It is scary. And we need to support them in that. And whatever everybody else is thinking, looking around at us, they can just go.
Yeah.
It's important. It's important. So.
All right. Got a couple questions in the queue, and I just put a message out to everybody that was in attendance. So we got about 10 minutes left. So if you do have any other questions, please use the Q&A function to enter those now. So first question, and this might be a best recommendation. I know that we've talked about this and shown a couple things. Can you think of a fidget toy or something that a child could pick at? And I think that it's because in this instance, the child picks at his nose, ears, lips until they bleed, which is not good. What used to happen is that he would chew on things, but he doesn't use something to chew on anymore. So suggested items that could be a substitute.
I've seen koosh balls used. Koosh balls to pick at, or like bendy things. I know you all have a ton of ideas.
Well, do you know what I want to point out to this actually is we went through that with my son early on, and we realized he was trying to give himself deep pressure. Getting the fidget wasn't giving him that sensory input of how it made his cuticles feel. And I mean, this was to the point, the picking and what have you, where he had to go on to antibiotics because it was getting infected. And so I do want to point that out, that it really is giving them an input. And so thinking about that again, is there, some heavy work? Is there, for us, actually brushing did work for him for a short period of time. We did the koosh balls, like you said, Mary, and that got him some of the picking. But as soon as all those little things were off the koosh ball, then he was back at himself. So we had to kind of get some of that, deep pressure through sensory integration, therapy and what have you, for him, for that more severe picking.
I think Kim might have frozen up. Leah?
I was going to say, I think, getting, if you're open to the idea, having maybe a potential eval by an OT or somebody who really understands, sensory systems and what he might be trying to access through that. Kim gave that great example with her son, and it may be the same. You may find that it's quite different. And, but I think it's great because they have like a treasure chest of tools that that way you don't have to buy a million things, right? Like you can go and see like what scratches the itch, more or less, to say, and you might have additional insight through that.
And Leah, you mentioned OT, just to clarify, it's occupational therapist. Is that correct?
Yep, sorry.
That's okay. Just wanted to make sure. Other thoughts?
Just to add to, not a lot of new on top of what's already been said, but just thinking about this and how, we did talk earlier a little bit. I mentioned some of the things that I've used before for folks who've engaged in picking, that's sort of like a habitual, picking of the skin or picking of the fingers. And we've done things like the koosh balls, great. Or one of my clients really liked if we put stickers all over a water bottle and they could sit there and just peel them all off. So things that sort of get you that peeling or scratching sensation. But I like that both Kim and Leah brought up, that sometimes there's something underlying that we need to address more than just that replacement behavior, which is always, it's a good thing to be thinking about. We need to replace this with something that's safe. But also I noticed in the individual who picked her skin, it was mainly when she was feeling very anxious and she had a stressor that was happening. So teaching her other regulation strategies or to walk away or things like that were sometimes just as powerful as teaching her what to do instead of skin picking in those moments.
Awesome. Got 2 questions remaining in the queue, and we'll leave time for final thoughts. So the first one touches on the issue of safety, possibly, or not necessarily safety, but it's just transition and environment. How can we help a child transition to a calmer environment or maybe a different location? Sometimes their 10-year-old is so involved in the meltdown that he refuses to leave the situation or the environment that is contributing to the meltdown.
I'm going to jump in on that because we run into that where my son will get stuck and he wants to perseverate on the thing that's upsetting him. And I think sometimes for him, he's not really aware of how stuck he is. And so we actually have this rule in our, it's called the 2 complaint rule, that you're allowed to complain about something twice and then you have to move on. And that's just, everyone in the house deals with that. But in a meltdown, sometimes, you know, if he's saying the same thing over and over again, say, you know, you can tell me that 3 more times, but then let's go draw some pictures, or let's go get Bunny, or, you know, whatever it is that's calming. And sometimes if he knows I get to say it a few more times, but there's a concrete end to it, it helps with that transition. It structures it a little bit more. So we add an extra level of structure. So that's a strategy we've used to help with that situation.
Other thoughts? Additions?
I think a couple of things. One, just being and you know, maybe this goes without saying, but sometimes we just have to step away and give someone space where they're at. We can't always transition them to another space. So, you know, of course, trying to find a way to create a calmer space where they're at might be what you're left with sometimes when transition isn't possible. But another tool I have found helpful with some folks, and I know we touched on this a little bit earlier, is to have some type of transition item to help them transition from one space to another, whether it's, hey, you know, do you want to go chill in your room on your bed and watch TV or listen to music? Maybe hand them the pillow that they can take to lay on the bed with that may indicate this is a transition to another space that is safe and calming for you. So for some individuals that can assist them rather than giving them verbal directions or trying to physically move someone when they're in a frustrated state or in a meltdown. Sometimes a transition item can be helpful.
Awesome. Okay, we just had one more question come in, and I want to make sure that we allow time for closing thoughts from Mary on this. I'm going to read the second one that came in first because it goes back to the issue of kind of personal and safety for those around. Roughly translated, it's what advice do you have when a meltdown or crisis situation escalates to aggressive behavior, biting, hitting, scratching, etc., and how to handle that situation? Is it advisable, or is it better to restrict or move the individual to protect them and others? And then how long do you have to, in some instances, possibly restrict or confine or kind of keep them safe so that they can calm down safely? Basically, I think that the issue is aggression towards themselves and others, and how can you redirect so that they can begin to calm themselves in the moment?
Has anyone worked in a school environment here? Because I can speak from the school environment. What I've seen is when children are small enough, then they're not, like, it seems like as children grow, I mean, I've heard people say like people grow out or mature out of autism, and I mean, they call it a developmental delay for a reason. Like there's a delay in communicating and all these things that are developing. So as they grow, they will be able to speak better for themselves and advocate better. But there's a point where when they're just not able, and they're aggressive, and usually they're small enough that you unfortunately do have to physically put them in a place where they're safer. And I could say deep down that child probably does feel pretty bad about that, and will probably need extra praise later to bring their self-esteem up because it feels really bad. But you just have to, and then just feel assured that as they grow and mature, they will start to grow out of some of those behaviors. And I know of adults who do are aggressive, and there is a point where sometimes you do need to get help from others who are trained in how to work with aggressive adults, and there's only so much you can do, and that's okay. It's okay to let go. You're doing the best you can. You're awesome.
Good advice. Anyone else want to add to that?
Sure, I'll add. You know, it is tricky because we don't want to crowd or overstimulate a person who is really upset. But with the aggressive acts, if you need to protect the environment and you need to protect siblings, inevitably, there is some blocking and moving things out that is involved. If it's a crowded space or whatever it is that in the room. I think that my best advice to this parent is that while supporting that individual, continue to follow some of the guidelines that we've mentioned, just emanating calm, moving things out of the way, giving space, as much space as you can, while also still, minimizing any potential damage that might be happening, or if that individual is kind of turned inward on themselves or maybe harming themselves, blocking for that. But trying to maintain that calm. But then when you or establish calm, but once there is true calm, and your other days that are good days, work on building up those other calming strategies. So when I'm upset, I could do this instead. I could take deep breaths. So we practice deep breaths, not when we're angry. That's not how we learn to take deep breaths. We learn to take them outside of that context. We learn to use our, visual schedule of telling you how I feel outside of an upset. That's a really good example to mention of, like, I feel like the other day when you couldn't find this, you were feeling pretty upset, right? That would be up here in the red zone. And using that as an example, but I think it'll be a longer journey with working on that. But your teaching is going to be on the front end on the good days, and just do the best that you can to help your loved one feel calm and supported, and guilt-free. When it comes to the remorse that Mary's mentioned, I mean, making sure that you're not forcing apologies right after, making sure that true calm is actually established before you're asking anything else of that individual, because they're probably going to be pooped. They're probably going to be feeling, not great. So that's, all I got.
We have some good visuals that are being shared right now.
You mentioned the red zone, and I just thought, sometimes we do have some visuals to help individuals communicate those feelings and put them into something concrete that maybe we can understand. But the teaching, as Leah said, happens not when they're upset and in the moment. We practice when they're calm, actually, and talk about things. But again, you can learn more about them. We have lots of great webinars we'll talk about at the very end on our website that our clinical team has put together to help you learn more about teaching these kinds of skills. And I'll just jump into, when aggression is there, sometimes if it's in a setting when there are a lot of people around, we do need to move the other people, because that person with autism maybe can't move. We need to give them that space. I know our son's bedroom was cleared of all the dangerous things when he was younger, because he didn't have that kind of control yet, and we needed to give him a safe place. Mostly he just threw everything out of the room and we just left it out, and that made it safer. And so, but we had the things he loved in his room, again, to help him calm. So these are just some examples of this kind of communication. And we've got, again, articles and things to help you learn more about how to use those. So
There's one last question that we haven't touched on, and then we'll wrap things up. This is a situation where the meltdown comes as a shutting down. So it's not aggression, not some of the things we've been talking about, but literally shutting down around strangers, doctors, teachers, etc. What are some strategies to re-engage or to get them to kind of move beyond the shutdown phase of a meltdown?
I would treat it the same.
yeah.
You know, get them to a safe space, let them, because it's still like lack of control, and then talk them through it. Feel blessed that it's not aggression. But yeah, it's all loss of control in here.
And if it's an extended shutdown, you know, if it's that they're not ready to talk, they're not ready for anyone to be near them or near their space, anything, you know, making sure the basic, like if it's a couple hours long, they're gonna maybe need water or food. Just go set it down. There's no strings attached. There's my favorite things. They're slowly appearing near me. What is happening? All my calming strategies have been delivered, and just do that. I mean, that's all I can think to do. Other than a lot of not doing.
Well, and I think if, you know, it's interesting because the question notices a pattern of shutdown when, you know, there's a new person around. And so, or being introduced and having to go talk to somebody. And so that's clearly a stressor. And so some teaching can go on the front end of that, you know, to prepare them for having to interact with somebody, to talk about, you know, how do we do in these situations and practice in less stressful moments what those skills might look at. So we can use social narratives to help with that. We can use, and I'll show you where to find some examples. And we can, you know, help practice and role play. So there are skills that we can be teaching, not in the moment again, but during another time, whether it's, you know, through school or through therapy, or just in your day-to-day, but within the context of being home, you can practice those things so that when those new opportunities, you go visit family, and now we've practiced and we've prepared for that, you know, it may not have as much of a shutdown.
It's kind of like in school when you were a kid and they did tornado drills or like any other sort of crises. And then so when it would happen, you kind of know how to go through it. It's kind of like that.
That's perfect.
And I think too, with a meltdown that doesn't look as explosive or as angry or things like that, you know, when someone is truly shutting down, it can be tricky as a caregiver to know, like, oh, maybe they seem calm, so I should be jumping in and talking. But I think that's where it's really important to observe over time and tell, like, what are the cues in their body or in their voice or in their breathing that show me, like, oh, they are kind of ready to integrate with me, and then really reintegrating very slowly and gently. And like all the things we've talked about, you know, don't point out the negatives and all the hard things about what happened, but focus on, hey, I'm here if you need me. I'll be right over here reading a book. I'm available. Just tell me when you're ready. Or, you know, just engage in something maybe kind of calm that they enjoy nearby and let them approach you when they're ready. So just making sure that we're taking all those steps to reintegrate slowly, even when it does seem like the behavior is a calmer, more peaceful behavior.
I know that whoops, I'm sorry, Mary, go ahead.
As an adult, working, helping others, I still am around people who are heavily lettered, heavily educated, all the things, and they just don't know what to do. So I feel like as a parent, or if you're an adult autism watching this and you feel like there's still people out there who don't understand, it's okay. I mean, it's not okay, but it's okay. It's okay that people don't know. There are so many people I feel who just don't understand. That's okay. That's reality. It's going to get better.
I think one of the things that builds on what you just said, Mary, there's the giving ourselves a little bit of a break in that, you know, we're all learning and things change over time. But there's also a component of sharing what we do learn with other people that might have contact with the loved one on the spectrum, so that they are better equipped to handle the situations that might come up whenever you're not around. Provide the tips that work, provide the triggers. One thing that I remember from whenever I used to work in a residential program for adults, we've been going through pollen season here in North Carolina recently. Behaviors, meltdowns, whatever you want to call it, they increased whenever allergies flared up, because they couldn't communicate that they weren't feeling as well. So again, trying to keep a record, some mental notes, using our notebooks to write things down that might be an antecedent, but also writing down what worked and sharing that with others, I think is a takeaway that we can all employ moving forward. So we are at 8:10. Mary, I wanted to make sure that we gave you the opportunity to share some final thoughts, and then we might have some slides to show people some follow-up information. But Mary, do you have final recommendations or words of wisdom to share with our audience?
Yeah, just that I want to thank you again, y'all, for giving me the chance to help y'all, because I mean, it feels really good. And I mean, it's been a journey, but I just want to assure everybody out there that there is room for growth. We are all going to get better, wherever you're at, whoever you are watching or whoever you're helping. Your children will move out of the nest. They will. We want more than ever to be functioning. Nothing feels better than to be useful, to feel loved, and to love others. We want that. So with that in mind, do not feel like we are just doing what we're doing. We want to get better. So we're all really, really grateful for all of you helping us, and just want to let you know there's hope.
Thank you very much. Others? Final thoughts?
I think I'm going to go ahead and let our BCBAs who are with us this evening share some final thoughts that they've got together. Let me see if I can bring that back up. Mary, this has been wonderful to share this evening with you. I've learned a lot as well. It's really been great.
I've been taking notes on what you've been saying too, all y'all.
Right. So Leah and Rachel.
Yeah, this has been so great. I love it. So really, this is it's a summary of the things that have already sort of come up in our natural conversation. So it's not something that we have to spend too much time on, but just in case anyone prefers written form, I am glad that we have these slides, because you can refer back to them. So just reminders: here are your caregiver behavior guidelines. Respect personal space. You utilize the person's cues to determine whether to be close or to not. Don't take it personally. Be aware of your body language and facial expressions. Don't want to have a discerning look, at all. I can't read the bottom.
It says maintain caregiver calm and switch out if needed.
Yes. So, especially if things are coming to a head, or, there may be siblings in the area, and things manifest more as anger or that sort of thing, then just keeping in mind that a switch out, if it's possible, could be helpful. So these are just our basic recommendations for sensory overload. So just initially remain calm. That's your job, the whole thing. But remove or modify the trigger if you can. Help to decrease stimulation in the environment. Encourage your loved one to take a break or engage in calming strategies that you've practiced. If you haven't practiced them, that's okay. Just do the things that feel most natural to you as far as comforting them and what you know to be comforting for them. If you feel that there may be some trend with internal issues, just go ahead and rule out pain, or go ahead and rule out hunger, thirst, offer those things up. Our loved ones might not always have the most might not always be in tune with their proprioceptive system, so they might not realize that they haven't eaten all day. So rule those things out, and make sure that you're being super notice if there's any pain or illness. So anything out of the ordinary. It's funny, David, that you mentioned the allergy example, because I'm not feeling quite like myself lately either. So don't forget about those things. They're just as important. And then increase opportunities for success, and follow your loved one's lead as they're reintegrating following a meltdown or shutdown. So here are some recommendations for recovery. And so, these are just a few things. So as your loved one calms, offer rest, be available, and give information, like Mary mentioned. Keep a calm environment with limited stimulation. Let them be in control of when they bring in the noise, when they bring in the extra lights, that sort of thing, if the lights are dimmed and the sound is off. Tend to basic needs, of course, and that might be just service, just delivering the things. It doesn't mean that you linger with the things. And never nag, blame, punish, or force apologies. Once they're calm, start by just slowly integrating tasks or transitions that will be successful, and then be ready to provide additional accommodations as needed. Yeah. And then most importantly, if there's not another message of the day, it's just take it as a learning opportunity. Like Mary mentioned, like it is a learning process. And so just ask yourself these questions. What accommodations can I identify? What's happening in the environment before, after? How do we limit the triggers, or how do we provide accommodations? Do we need to think about something like headphones for the loud public restroom that never gets quieter? And how can you help them to begin to identify their initial signs of stress? So not when it's at 100%, but maybe when it's at 50% or 70%, like, ooh, my stomach feels fluttery, my face feels hot, things aren't right, it's too loud. And to begin to advocate. And if you're not sure, seek a professional. That's what we're all here for. And caregivers are the ultimate professionals, and they figure a lot out. So we learn a lot from you guys, and sometimes just an outside view, a new set of eyes, can really help to identify maybe the pieces that are missing. So yeah. That's what we have kind of in summary.
Oh, great. Thank you, Leah. Thank you, everybody. This has been really great. I just wanted to share a couple resources with you that the Autism Society has for those of you. Our clinical department, we have several representatives here from our clinical department, but they offer rapid response consultative services that you can access through telehealth. It's usually about 2 to 4 sessions to work on a specific skill or issue. It's not meant to be a crisis service, but it is a way to maybe learn how to integrate some visuals into your day to put together some communication tools or something like that, just to get things started. And then for families in some of our counties, we offer lifelong interventions, which is our applied behavioral analysis program here at the Autism Society. It's not available in every county, and not every insurance coverage policy covers it, but you can reach out to our clinical department to get more information. We do have that service in a range of counties across the state. Autism Resource Specialists, another resource that's my department and Kim, and there are 20 of us across the state. And we're all parents, and we're here to help you connect with resources, learn more about autism. And you can find us on the Talk with a Specialist page on our website. And we have other resources on our website to check out. Just go to the Gain Knowledge tab and you'll find toolkits, you'll find webinars, a whole section on behavior, by the way, and lots of other information like how to navigate services, or guardianship or transition to adulthood. So there's a whole lot of topics. We have a blog that comes out regularly, a whole page dedicated to safety, lots of great resources there, social narratives that you can use as they are written, or you can use as a model for writing your own. And then we do have a resource directory, all available again if you go to Gain Knowledge on our website. And then finally, supporting each other, parent to parent, is really key. My first connection with the Autism Society of North Carolina was through a chapter. And I gained support by meeting other parents. And that was a long time ago, like 25 years ago. But the Autism Society's been here for over 50 years now. We're 51 years old. And I'm just so grateful for having had that opportunity to meet other parents. That's actually how I met Kim, and was through the chapter. And so, you know, this is a great way to learn about resources, to learn the tricks of the trade from other parents. Go to our website to find your local chapter. We do have about 50 chapters organized by county. If there's not a chapter in your county, please contact the chapter department, and they'll help you get some support as well. You can always go to a neighboring county if that's the case.